Hi there, my name is Deidre and I'm here to talk to you today about the PDT ALA treatment with Levulan, blue light therapy. I'm having it done later on today. It's now early morning, Friday morning. I've just had my shower and I'm getting ready to go to work, and I'm having the treatment after work. So what's going to happen today is I'm going to show up there and they are going to take off all my makeup, expose what I don't want to be seen, but that's okay. They will clean it up with, I think, an alcohol-based liquid to make sure it's all off, cleaned out, whatever. They're going to take the Levulan stick. They're going to put the Levulan medication all over my face. The Levulan ingredients in it, I'm not sure what it is, will activate the cells of the actinic keratosis. It will sit on my face for a few minutes, I'm not sure how long, and then they put me into some type of light chamber, light room, I'm not sure. I believe it's a blue light, and then I sit in the blue light for about 15 minutes or 20 minutes, and then after that I also am going to be having a laser treatment that they follow up afterwards. I'm not sure why, but just do what I'm told. I have had actinic keratosis for a few years now. I have had different types of treatment done. I've had the liquid nitrogen put on my hands and burnt spots off, and it's been nasty. It hurts having it done, and then afterwards you blister, and some of my blisters have actually even gotten infected and they look nasty, and it is what it is. You have to do what you have to do. I've had some taken off on my face as well with that treatment, and I've also used Fudex, so anybody that's had actinic keratosis, precancerous cells, have probably used this type of treatment as well. And what that does is you put it on, and you put it on for about 2 weeks in the affected areas. It attacks the cells, they start to turn red, and over a couple weeks, and then all of a sudden there are all these red spots only in the areas that you have the precancerous cells. And then eventually they scab up and dry up and fall off. So it's not pretty. It works. It's an awesome treatment. I work every day. I work in a dental office, and thanks to my boss I get a week off work because of this. But I don't want to have that look and effect to me because I do work. If I was home, different idea, different story. I would probably go that way. Well, right now that's where I would think I would do. My dad has the actinic keratosis. We have a very fair family, blonde hair, fair skin, German side, English. It's just not going to happen with the dark skin in our family. So we've had a lot of exposure to sun and damage, and I'm doing this video to help people my age dealing with this, and also to help my children understand the importance of sun damage and what it can cause. I fortunately don't have melanoma. I don't want to have it, and I'm sure nobody does, so I want to get this treatment done and over with. Apparently it's going to take 2 to 3 treatments, 4 to 6 weeks apart. This is my first treatment. Very nervous, have no clue what to expect. That's why I'm doing this video, to help everybody else out. I'm going to try and show you what I've got, but I do have quite a bit of makeup on. I have BB cream, I have foundation on, I have concealer, I have what else do I have on? Bronzing cream or powder, and I've got everything on to cover up. I'm like covered. So what you see is going to be 10 times worse without the makeup. So over on my forehead you could probably already see some damages, damaged areas. They show up and feel kind of like they're scaly areas. You can see here, there's a big red spot there. It's pretty scaly and dry feeling. This is like a sunspot, like a freckle. Can't even tell it's there except for the fact that you can see it, and I can't cover that up. I have a lot of redness through here, and even in my part. I do have a spot here of the actinic keratosis, and down here, I don't know if you can see it or not, on the side, that usually comes up quite a bit. And with these spots, they actually are like little dry spots that turn into little scabby things that fall off and are gone, and then they come back, and then they're gone, and then they come back. Another spot here that's a pretty noticeable spot is here. I do have some sun damage and some veins, so hopefully this treatment will get rid of that as well, like a little extra bonus. Spots here. I had one burnt off in this area, but it ended up scarring, and that was with the liquid nitrogen. So I don't want to do that on my face anymore. So I'm going ahead with this treatment. I want you guys to ask me any questions that you have. I will do my best to let you know the answers if I know them. I have seen videos on this type of treatment for younger girls that are doing it for acne. I've seen this treatment videos for an older gentleman that had quite a bit of sun damage to his face. Figured 40-year-old, why not? There's not one on there yet, so I hope I help you out. I don't know what else to tell you, but except for the fact that once I have this treatment, I can't be in any sun for 2 to 3 days. I'm locking myself in the basement, away from all sun. I can't even be in a light bulb. I don't even know if I can use my phone. I don't know if I can watch TV. I'm going to find all that out today at the doctor's office. If that is the case, I don't know how I'm going to be able to videotape. If I do, I'm going to do it real quick and then shut it down, because this Levulan cream treatment, or whatever it is, actually it works on the cells when it's activated by light. So the light treatment that I'm having done at the doctor's office is all I want done. I don't want to overexpose and then have more damage, or damage that I shouldn't have. So I'm listening to the doctor. I'm going to shut out the lights for 2 to 3 days, and we'll go from there. So any questions, let me know. Wish me luck. I'm nervous, but we'll get through it together. Okay? We'll talk soon. Bye.